Meath-based pharmacist Kathy Maher is on the executive committee of the Irish Pharmacy Union. She joins me now. Kathy, you've been calling for this step and campaigning for this step since 2006. Why was it so important?
It's so important. It's been available in most European countries for quite a number of years. In fact, our nearest neighbours, the UK, have had it across the counter since 2001. So really, it's timely access. We welcome this move from the IMB. It's great for women's health that women can now avail of this by popping into their local pharmacy.
And presumably great for the pharmacists around the country as well. It is more and increased business. But what additional benefit does it bring? Women could already go to their doctors, or they could go to family planning clinics.
Absolutely. Well, as you said, it has to be taken within the first 72 hours after unprotected sex. And it's actually clinically more effective if it's taken within the first 24 hours. So to step back and think about, sometimes unprotected sex happens at weekends. Not all GPs sit at weekends. So the pharmacies are there, they have extended hours, they're without appointment, they're accessible. The pharmacist is there to go in. You can just pop in on a lunch break during work, and it's accessible. It can be received really, really quickly, and therefore it's more effective.
Yet the regulatory body for pharmacies, the Pharmaceutical Society of Ireland, it hasn't published any guidelines yet as to how this pill should be distributed to the public. So we're very much down to each pharmacist acting responsibly.
Well, that's exactly it. Each pharmacist is a qualified healthcare professional, and yes, PSI hasn't currently drafted their regulations, but I understand that they're on their way. But each pharmacist is a healthcare professional and will use their professional judgment and discretion as to who is a suitable case. Not everyone will be an appropriate candidate for emergency contraception, and that's when the pharmacist makes the consultation. That's what they will decide.
Why is the Pharmaceutical Society dragging its heels on issuing these guidelines?
I don't think it's a case of them dragging their heels. I think the guidelines just aren't quite ready. This move came about very quickly, and we didn't expect it just quite so suddenly, and I think it was just a slight time delay. Now,
Boots began selling the morning after pill. It's over a month now since they introduced it. They insist on mandatory consultation. Is that how you and other pharmacies will operate?
Well, when they brought it in a month ago, they brought it in under a PGD, which was a patient group directive, and they had a medical director sign off on training that their pharmacists could provide the service. At that point, it was still a prescription-only product. The IMB have made this move today to make it a pharmacy product, so it can be sold without the need for prescription, and that is the difference. Pharmacists will still provide consultation because we need to check that the patient is an appropriate candidate. We need to check when unprotected sex actually happened. If it's gone beyond 72 hours, that patient would need to be referred to a doctor or family planning clinic to have maybe a coil, an IUD fitted. We need to give them advice about what would happen if it fails. We need to give them advice, check out the medications that they're on to make sure that there are no interactions.
Kathy, how does that work? Is it a questionnaire they fill in? Is it over-the-counter series of questions that will be asked? Or is there a private consultation involved?
Well, every pharmacy now has a private consultation area in place now since November. So obviously this is an embarrassing situation for women sometimes, and a lot of the women are in their 20s, 30s, 40s. They've had their families. Something has just happened. Maybe they've had contraceptive failure. They've popped in. They'll be taken into the consultation area, and it'll be just a quiet consultation. Whether there's a paper trail, whether the pharmacist documented or not, it'll be up to each profession to do that. But the consultation will be there.
Many others might be teenagers. Some might be people using the morning after pill as a regular form of contraception. They may not be known to you. So how are you going to take all of these risk factors into account?
Well, you have to interview the patient. You will have to base each thing on case by case. Emergency contraception is only ever for occasional use. It's not suitable for regular contraception. We would urge those patients to go back to their GP and speak to them about regular forms of contraception. Each consultation would be a key part, a key opportunity to speak to patients about health promotion, about safe sex methods, to make sure that they're not using it for continual use.
It's a lot of extra responsibility on a pharmacist, isn't it?
Well, pharmacists are healthcare professionals. We're trained for it, and we're very well equipped, and we're accessible without the appointment. So we're there 9 to 6, 9 to 7, 9 to 8, 6, 7 days a week. So we're there for that reason.
And how much will it cost?
Again, it will be down to each individual pharmacist. It will depend on how much they can buy the medication at. It will depend on how much the cost of a particular consultation can be provided in that particular pharmacy.
Can you give us a ballpark figure, not more than, between?
I have no idea. As I say, it will be down to each individual pharmacy because we can't set prices. We can't price fix.
But would you see it as that you will no longer have to pay to a doctor? You won't be paying the GP charge. So would that be factored into the price that will be charged over the counter for the pill?
Well, as you said, there won't be the GP charge, so obviously we won't be charging a GP fee.
Yeah. But you don't. How much will you charge for it?
I haven't decided yet.
You can't give us any idea.
I honestly haven't decided yet.
Okay, but it's being sold to us from today.
It has been sold from today. We haven't sat down and written our protocols yet. We've had no research.
Have you got it in your pharmacy?
I'm waiting on delivery this afternoon.
You still don't have to. All right, Kathy. Look, what about there's a number of other drugs that are available over the counter in other EU member states. You want to see them deregulated. When is that likely to happen?
Well, again, it's up to each of these companies to apply to the IMB to have their regulation status changed. So things like chloramphenicol for bacterial eye infections, or fluconazole for thrush. We would have a lot of patients that would ask us for an oral treatment for thrush. There's another drug called sumatriptan for migraine. There's quite a lot of medications that are available. A good safety record available from pharmacists across
and you
the
can't
EU.
dispense at the moment. We have a text in from one of our listeners who says, and ties in with what you're saying, the morning after pill now available over the counter. The daily 75 milligram aspirin needs a prescription.
Absolutely, and that's one that we'd widely call for because you can buy aspirin in the form of Disprin across the counter in a 300 milligram strength, but we can't sell it across the counter because of the licensing of that product.
All right. Well, Kathy, thank you very much for joining us. Kathy Maher, on the Executive Committee of the Irish Pharmacy Union. We haven't got a price for you on the morning after pill, but perhaps some pharmacists who have it in stock might let us know what they are charging customers for the morning after pill now. That's Kathy Maher. Thank you for joining us. It's